Hi everyone, I want to welcome everyone to Fargo Center for Dermatology's first session of Ask the Derm. So what is Ask the Derm? We have decided to develop this as kind of a platform for all of our followers, for all of our patients, and as a way for them to be able to ask the questions that they might not be able to have the confidence to ask us, or they just might not be a patient of ours yet, so they haven't had the chance to ask those questions. So what we have done is we put a request out on social media and just kind of launched and said we're going to have our first Ask the Derm session and throw out those questions that you always wanted to ask, and we're going to answer those for you. If you don't know who I am, I'm Dr. Rachel Ness, so I'm a board-certified dermatologist and owner and founder of Fargo Center for Dermatology. So here is our questions, and these are from you, all right? One of them is, and this is actually a really common question that we get, it says, how do we remove acne dark spots from a teenager's skin? And this is a really common question. I think what they're trying to ask is, how do I fix post-inflammatory hyperpigmentation? So what happens with a lot of teenagers, what happens with a lot of teenagers with acne is, if they're picking at it, or simply if the acne is just so intense, the inflammation, what happens is it leaves like a little spot behind. I always say it's kind of like that footprint left behind. So even though the acne is gone, I might have an acne patient that comes in and I'll say, okay, I wish I would have met you a year ago, 6 months ago. You know, half of what you have is acne right now, and the other half on your face is actually post-inflammatory, either hyperpigmentation, which is dark spots, or post-inflammatory erythema, ice pick scarring. This particular question is about the dark spots. So, and most of the time it isn't just dark spots, it's oftentimes a combination of all of those things. Actually, depressions in the skin, ice pick scarring, and then the redness. So specifically to address the dark spots, you know, we do different things like hydrofacials to kind of help with rejuvenation. We'll do different things like some different exfoliating, that type of glycolic acid, alpha and beta hydroxy acids we'll use on the skin. There's different chemical peels. We have a specific chemical peel that we use here called our Perfect Peel that has an acne booster on it. So that's another one that we use for a lot of our acne patients. And it actually treats active acne, and then it treats some of that post-inflammatory hyperpigmentation. So I would say if you're that one who wrote this question and you wanted to know specifically, maybe you only have dark spots left, maybe your acne's done, I would probably say, without looking at you, that I would recommend a chemical peel, and we would do our acne booster. Knowing that that's not probably the majority of our patients, the majority of our patients either still have some active acne that's still going on, plus they're dealing with some of that ice pick scarring, they're dealing with depressions and their depressions in their skin, and then they're also dealing with some of that redness. It can even be almost like a purple color. We call it kind of purpura changes. Then I oftentimes, one of my most common procedures is doing something like our skin pen microneedling procedure that we'll do. If it's a really intense acne scarring with a lot of issues in like pitting in the skin, we'll add like PRP onto the skin topically to really help boost that collagen and elastin. The other thing that I'll oftentimes add is making sure I've got that teenager on a topical retinoid, because we know that topical retinoids are great for many things. They're great for active acne, they're good for scarring, they're good for skin remodeling, they're good for evening out any like dark spots. So if you're that person, definitely make sure you're on probably a topical retinoid. We have a couple other ingredients that really also help hyperpigmentation. We've got things with kojic acid, azelaic acid, tranexamic acid. So, and other types, we've got a couple. We have an acne exfoliating pad that contains a little bit of glycolic acid, lactic acid in it that is really, really good, you know, and has a really great pH balance. So that would be another great product that they can consider. We have an oil control pad, which also helps with that oiliness of acne, but it also does help with some of those dark spots. So that is our question about how to remove, you know, acne dark spots from a teenager. Okay, so we'll go on to the next one. Our next question is, how often should I get a full body check by my dermatologist? And really the answer is it really depends. And so, but we get this question every day. You know, they say, when should I start bringing my kids in? When should I tell my wife to come in, my husband to come in? And the really good question is risk factors. You know, first of all, if you have a lesion that you're concerned about or spot, it's changing, you know, it's itching, it's painful, it's bleeding, then you need to come in. But then when you come in, I always say, just come in and then we will help you. We'll kind of go through your risk factors, because some of those risk factors we look at is, you know, how many moles do you have? You know, there's actually a syndrome called numerous mole syndrome. So if you have greater than 50 to 100 moles, that puts you at a risk factor. And then we'll ask you, do you have any family history of skin cancer? Do you have any family history of melanoma? If you say yes, you're probably looking at, once a year. If you have a family history of melanoma, but maybe you hardly have any moles, you might be someone that we can see every 2 years or 3 years. But if you do come in and we find moles that, maybe we don't need a biopsy, but maybe we need to measure them, do some medical photography on those, you might be someone that we say, you need to come back, once a year. And, maybe oftentimes I see people more in the beginning. I say, I just need to get to know your moles. If I meet a new patient, I say, okay, I'm going to look at you really head to toe. I never usually look at 1 mole or 2 moles. I say, I need to see what kind of moles you grow, just to kind of get to know your moles. Once, if I see you for a couple of years and we've really documented a lot of stability in your moles, we might extend those visits to every 2 to 3 years. So, and some people I'll see once and say, you know what, you have no risk factors, you have no moles that I'm concerned about. I really am going to discharge you back to your primary care doctor. And then if you or your primary care doctor find anything, come on back and see us here in the dermatology office. So, summary is to that question, how often should I get a full skin exam by my dermatologist? It depends. Okay, but if you're worried, come on in. We'll take a peek at that. All right, we're moving on to our next question on our Ask the Derm. Our next question is, what are your treatment options for large congested pores from an oily T-zone? So this is a problem that many have. So large congested pores, we definitely see, especially in our T-zone area over time, especially if you have underlying like rosacea. And just as we age, we notice those pores a lot more. We get a lot more fibrosis in our skin. And then we see these white heads, we see black heads. And typically when they talk about congested pores, we're seeing the open comedones, otherwise known as blackheads, is what we see them as. And so the number one product for those is, one is treating if there's any underlying conditions, treating the acne, treating the rosacea, or anything that's creating those dilated or enlarged pores, all right? Because definitely if you look at like a newborn versus you look at someone who's 60 years old, the pore difference between those differs drastically. So just time on earth is going to change your dimensions of the pores in your face. So other things, a lot of people have oiliness. So we have, oil control pads or other things to really take away that oiliness. But number one thing is we want to get rid of that congestion because we don't want those things sitting in those congested pores. So using retinoids, that helps with cellular turnover, it helps with that congestion, getting all those pores cleaned out. That takes 4 to 6 weeks to work. So I would say now those actually could look worse, your pores, for a week or two, as we're starting out, even up to 3 or 4 weeks, because we're trying to clean all of that out of there, all right? So that's really helpful. Is retinoids are probably my number one thing that we use for congested pores, but then we also have a lot of technology, because even though once we get all that congestion out of there, innately as we age or underlying skin conditions leave us with those dilated pores, so then we'll use other technologies that we have to shrink those pores, okay? And those would be things like skin pen, microneedling, radiofrequency devices, or different things that we use. And we also have, for those that know that they don't want to do any of those things, we have other things like actual topical medications that are called like our pore minimizing cosmeceuticals that we use on the face, which just can temporarily reduce those, especially if you've got photography coming up or pictures, maybe your wedding pictures coming up, and you're going to have a lot of close-up photos, and you don't want to see your pores. That's just a great quick option, is just to use one of our topical pore minimizing type of products. Okay, we have another question. One is, does removing skin tags leave a scar or a mark? The answer is possibly. So we always like to remove skin tags when they're smaller. So the smaller they are, the smaller mark I'm going to leave. Anytime I do anything to the skin, even if I get a paper cut, I'm going to leave a little bit of a scar. It all depends on how you heal. Typically, I would say for skin tag removal, minimal if any. If you've got, we have some people that come in with, scars or with skin tags the size of like a giant peanut M&M, so those potentially, depending on the base of them, typically they're usually like a larger lesion if the base is smaller. So it just depends on how large that base is. We'll choose the technique on how we want to remove those. We have different devices to remove those to really try and minimize the scarring. But in general, to answer that question, does removing skin tags leave a mark? Usually not, okay? But it also depends on how you heal. Next question that we have here from our Ask the Derm from you guys is, I am scared to try a retinol. Where do I start? I love this question, and I love the ambition, because they already know that they need to do something wonderful for their skin. A retinoid is something, and all retinols are something that I like most of my patients on. Even from young patients when they've got acne issues, And then as we get a little bit older, oftentimes we're trying to fix acne scarring, post-inflammatory hyperpigmentation. Maybe you've got some melasma issues. Maybe you just want to do it for rejuvenation, for anti-aging. I've been on a retinoid for, over 20 years, and it's one of those things that I always say I've retinized my skin for 20 years. So you aren't going to be able to use the same retinoid that I am, because I've been prepping my skin for about 20 years. So when you start slow, okay? So we give you a sheet, and it literally on our sheet talks about week 1, when I start you on a retinoid, you're going to use it like once a week. Week 2, you might use it twice a week. Week 3, you might do it 3 times a week. I mean, you kind of get the concept. And then I basically tell you, we'll try and get you up to maybe every other day. Sometimes we'll get up to every day. I mean, sometimes that is our goal, sometimes it's not. The other thing we'll do is we'll start depending on your skin type. The first question I'll ask you is, do you have sensitive skin? Do you have dry skin? Do you have tough skin? And that really guides me. And I'll also say, have you tried retinoids before? If you've had an unsuccessful attempt with trying a retinoid, and we have a lot of people who come in here and they're scared when I suggest it, I say, you know what, there's 100 different retinoids. I will find a retinoid for you, okay? It's a little bit of trial and error, and I mix retinoids. So I'll start you on a little bit more of a less irritating retinoid, or retinol, and then I'll switch you and we'll add maybe. So I actually have like 4 or 5 different retinols on my counter at home, okay? My advice to you is, since you're scared of trying a retinol, where do I start? Is start with a lower potency one. Start with one that we know is less irritating, so we can help guide you on a couple suggestions on those. Start out small, start out less often, and just kind of increase as tolerated, okay? But you will get there, okay, with a little bit of work, okay? Next question is, have you used Botox and masseters to treat bruxism? And then in parentheses they wrote, and slim the jawline. So for those who are kind of questioning, what is Botox? Botox is one of our neuromodulators on the market. There's 4 different ones in the market right now. So Botox is something that relaxes muscles. We use it a lot of times for like rejuvenation in the face, to relax so we're not wrinkling. But we can also use it to relax other muscles. So the masseters are that muscle. If you like take a piece of gum, chew a piece of gum, and you can feel, on the sides of your mouth right here, you can feel these muscles called masseters. Well, what happens is sometimes these become overactive just because of genetics, or maybe you're a gum chewer, or maybe you're a tense person, or maybe it's just a habit you've developed. A lot of people get this disease called Bruxism, is what they were asking about, and really what that is teeth grinding. So maybe your dentist has put you on like a bite plate so you don't grind your teeth at night, because maybe you end up with headaches, maybe you end up with TMJ, or temporomandibular disease, where actually you have pain in your jaw. And so yes, we do use Botox and the masseters to treat that. It works for those if it truly is an overactive muscle issue. And that's really the biggest thing. So we always say, chat with your dentist, chat with your oral surgeon, make sure that that's actually, what the issue is. We can sometimes help guide you and say whether or not you need to see a jaw specialist on those. But if it is an overactive masseter muscle, then absolutely yes, we'll inject that muscle. And we do that for medical reasons, for comfort. But the benefit is a lot of people like that slimming of the face that goes along with it. So by slimming down and decreasing that bulky muscle, we all like muscles, okay, but we don't like them in our masseters, okay, because it does actually ages us, okay, causes discomfort, and it makes us look more masculine in a lot of our females. So it's a great thing. How often? That's another question. Typically, for the face, where we do injections every 3 months, for masseters, it's really only about every 5 to 6 months. So oftentimes I'll put people on and say, okay, I'm going to see you every 3 months for your facial wrinkles, and we're going to inject those. And then every other treatment will add on that masseter injection. So twice a year for the jaw, 4 times a year for the face. So answer is yes, we do treat it. It works in those. It works in a lot of people really, really well. But if that's not your issue, it's not going to work for you for your teeth grinding. Okay, Ask the Derm. We've got another really great question here. So this one says, what is the best product for melasma? That is a really good question. And for those who don't know what melasma is, the person who wrote this in probably unfortunately knows what it is really well. So melasma is hyperpigmentation in the face, so brown spots. And again, there's many different reasons people can have brown spots on the face, and only one of them is melasma. Specifically, it's a type of a darkening of the skin, oftentimes seen associated with genetics, pregnancy, sun, hormones, birth control. And people will start with this almost like a mask kind of look. Most commonly, we'll see it kind of on upper lip. We'll see it on cheeks. We'll see it on forehead, and really those sun exposed kind of areas. But you can see it in many other areas on the body too. But specifically when it's on the face, we call it melasma. And what is the best product? There really isn't a best product. I always say, treating melasma is super, super tricky, okay? And so I always say there's never one thing that we can do to treat melasma. It's many things. So if specifically this person who reached out to us wanted to know the product, I'd say product-wise, you're looking for something possibly that has a hydroquinone. There's pros and cons to using hydroquinones, and I definitely have people who want alternatives to that. And whether or not they fail the hydroquinone or they just want an alternative. Other products you can do are kojic acid. You can do something like azelaic acid, and then you'll hear me talk about retinoids. I put all of my melasma patients on a retinoid, and we'll find one for you. There is another ingredient, tranexamic acid, that we'll also use. So there's quite a few different products. Also, vitamin C is another great product for that. And then the number one thing I would say, though, before you even listen to any of those other products is sunscreen, okay? So that is the number one thing that you can do for your body for treating melasma. Sun avoidance, hats, and you actually can't, you also have to not just avoid sun, you actually have to avoid heat. So that thermal, like if you're outside on a 100-degree day and you're shaded under a tree, even just that intense heat can actually trigger your melasma. So we also have to, sometimes I'll take females, I'll come in and say, okay, the reason why your melasma isn't getting better is because you're on an oral contraceptive. So we may have to switch them to a different medication, to a different contraceptive, okay, other than a oral contraceptive, because that's actually feeding the melasma, okay? So even if I pick wonderful products to put at you and you continue to get a lot of sun exposure, or you're on an oral contraceptive pill, or you're pregnant, okay, those are things that are going to make you a difficult patient to treat. But thank you for whoever asked that question about what's the best product for melasma. His final answer is there's a lot of things. Oh, and I should comment though, we also do other things for melasma. So sometimes for those who are really tricky, we'll put them on, we've got different melasma regimens, skincare products, but we'll also treat them with chemical peels or other devices that we'll use, like Skin Pen, PRP, or other things that have been really helpful for melasma. We have another question here that someone asked here for Ask the Derm, and that one is, how do you know if you are a good candidate for Kybella? So Kybella, for those who aren't familiar with it, is a product that you can use to treat unwanted fat. It's FDA approved for that fat in the submental area right here. It needs to be pinchable fat, okay? So if it is fat that is not pinchable, okay, or if it's redundant skin on that area, or you have a lot of skin laxity issues, you're just not going to be a good candidate, okay? So it has to be that fat. So a lot of patients will turn away for Kybella and will say, you're just not a good candidate. I don't think that's a good investment of your money. So it's a tricky product. It's a great product, but you have to be a good candidate for it. So with that one, I would say come on in. We just got to do a little pinch test with you. We'll have you do a couple different motions to kind of like flex those muscles and stuff to see that the fat layer is in the right location. Okay. All right. Next question that we have is, what is the new trend of slugging actually beneficial for your skin? So this is a fun one. So slugging is a kind of a trendy thing that's going on. People talking about, should I be slugging my skin? And really what it is, it's something that's been going on for many, many years. We use it in dermatology. I think they just gave it a new fun word called slugging because it actually really sounds quite fun, okay? So slugging is just really using a highly occlusive product like called petrolatum or white petrolatum on the skin, or like Vaseline on the skin. And so it's awesome. It's awesome for all my patients who are dealing with really dry, sensitive skin. And guess what? I know we live in North Dakota here, and it is actually, quite cold this time of year. We all could probably use a tiny bit of slugging, on our skin. The one issue is I really caution you though, it's a very, very occlusive activity to the skin. So if I've got an acne prone person or someone with really oily skin, I'm not going to recommend slugging for you. But if you don't have any of those tendencies and you really fight with dry skin, slugging's great, especially if you do it at night, give your skin some time to repair. I oftentimes say we do slugging for the hands all the time. We have a lot of people that come in there just with hands, they're uncomfortable. We slug the hands. We basically have them we do an occlusive petrolatum similar to like Aquaphor or a Vanicream ointment on the skin. We literally have them put gloves on at night and sleep in those for 8 hours, and that would be a similar thing to that. So you can definitely do it, okay, if you don't have those underlying predisposing factors, and it definitely can help you, but don't do it if you have those predisposing factors. So I'm just going to run through my list and make sure I answered everything on my list here that came in, because I don't want anyone to feel like I have left them out. So I have officially finished answering all the questions that came in for our first session of Ask the Derm. And so I just thank you guys for listening. I'm hoping you guys found this helpful. I know a lot of you might not have access to a dermatologist. You have questions, and if this is something that people find that they really like, our followers will definitely keep on trying to do this. And we'll be in the future here trying to reach out again and asking for people to submit their questions, and then I will be happy to answer those. So I hope you guys all enjoyed our first session of Ask the Derm.